empty, hopeless, helpless. You can't sleep. You don't eat. I never read the paper. I never read a book. I didn't have any passion in me. When I was depressed, I was existing, but I wasn't living. There was no way out.
This is what clinical depression looks like.
I was thinking of suicide.
And feels like. But then, so is this.
Unbelievable, the beauty of these mountains.
What made the difference for Al Peters and almost 6 million other Americans is this.
I take one capsule once a day.
A little beige-green capsule.
Bottoms up.
And that's called?
Prozac.
Prozac is one of the new generation of antidepressants that seems to correct a chemical imbalance in the brain that could be the reason so many people have such dark days.
You know, I wake up in the morning feeling worthless.
At this support group in Boston,
And I got put on antidepressants.
5 of the 7 patients with depressive disorders have used Prozac.
I was lucky. The first medication they tried worked, and it was Prozac.
Prozac was making me normal.
It was a new feeling.
My self-esteem has gotten better.
I just can't believe the transformation that drug has made in my life. Last year, the first year that I was on Prozac, was the best year of my life.
Al Peters is 67 years old and a self-described ski bum.
When I retired, I decided I'd ski as many days as I could, and that I wouldn't cut my hair anymore.
He spends all winter on the slopes of New Hampshire.
Well, every morning I come out here, I just think how grateful I am that I'm alive.
That's not the way he felt just a year ago, shortly after retiring from his dental practice in Boston.
As I got older, it became more and more difficult for me at times to live within my own skin. The sadness that I felt persisted for several months, and it just didn't go away.
That's when Peters began to take Prozac.
Prozac is a liberating experience.
But do you get a high from a drug like this?
It has absolutely no effect on producing a euphoric sense of feeling. I don't consider it a mood brightener. I consider it a mood stabilizer.
When Prozac first came on the market, doctors were reluctant to prescribe it. They were concerned that the drug could increase the risk for suicide. Well, no longer. In the last 7 years, Prozac's reputation has made a miraculous recovery. The concern is now that drugs like Prozac, with very few serious side effects, will be used not just by depressed individuals, but by perfectly healthy people who want to make their lives better.
There's a definite use here in town, and yes, it's on the increase.
In the small New Hampshire town where Al Peters spends his winters, the local pharmacist says the word is getting around.
Like I said, there's this one lady that she's got to be in her early to mid-60s, and she said she feels like she's 16 all over again.
A patient came to me who wasn't really depressed a lot of the time. She had a few bad days a week.
Robert Aronow is a Massachusetts psychiatrist.
And she said, I want to go on Prozac because a friend of mine went on it, and she got a lot better.
He has started raising ethical questions about the Prozac phenomenon.
Is that a bad thing necessarily, that someone might be a better person, quote-unquote better person, under Prozac?
Well, absolutely. I think someone being a better person, depending on how you define it, probably isn't a bad thing. But if somebody's fine and they're doing well, and they ask me to give them a foreign chemical that may change the balance of their brain, that raises a lot more questions, because you might change things in a way that you can't anticipate.
So what about Prozac user Al Peters, a man no one would have described as depressed?
I would go through long periods where I would not be depressed, particularly years ago when I was younger.
His own home movies show a man full of life, surrounded by family and friends.
It took me a long time to admit that I was suffering from a depressive disorder. I hid it from most of my very close friends. And it was the pain of living through depression that finally sought me to seek some professional advice.
Over the last 30 years, Peters has seen at least 5 different psychiatrists.
But despite the insight that I gained, and I worked pretty hard at it, the depression still came back despite all of the work that I did in psychotherapy and counseling.
When he first came in, he said that he found himself at times bursting into tears, his appetite was down, and he had a weight loss.
Dr. Gerald Rosenbaum is the psychiatrist who put Peters on Prozac.
He had a mild to moderate depression, and these medicines, by and large, don't work for people unless they have an underlying condition that is a disorder.
Hi, honey.
He's on medication, and I'm glad he's the way he is and not the way he was then. And then
Al's second wife, Ginny, has been with him for the past 10 years.
There's that big of a difference?
Definitely.
The difference between when I'm on Prozac and when I'm not in Prozac, I might be depressed for an hour or two or even a day or so, but then it goes away. It's going to snow tonight. Yeah.
You don't get counseling anymore?
No, I have not had any counseling for about 5 years now.
Oh, you did? You killed the bug, huh?
For Al, is it enough then just to use the antidepressant?
Absolutely. In his case, antidepressant alone is certainly adequate.
In fact, many people seem to be replacing psychotherapy with a pill.
Are you seeing more prescriptions by general practitioners?
Yes, than we used to. Most of them used to come by from psychiatrists, but now they're general practitioners.
And what does that say to you?
That says that more of it's being prescribed because more people want it and they don't want to go to a psychiatrist to get it.
That's the case, even though the drug does have some side effects.
Headaches.
Feeling queasy or nauseated.
Insomnia occurs in 13% of people.
About a third of people on these drugs may have changes in sexual function, decreased libido.
Well, look at the bird flying around there. See him over there in the tree?
A few months ago, Al Peters decided to stop using Prozac.
And I began to feel a recurrence of the same old symptoms.
I looked at him and I felt so bad because he seemed not himself, or he seemed sad.
I'm more prone to an angry response.
Nothing I said seemed to be the right thing, or I couldn't say anything that was the right thing.
And he's on the
And so this past November, at his wife's urging, Peters went back on Prozac.
Is it possible that you're taking Prozac because you want more than life normally offers?
I don't think it's so much a wanting more out of life than you might have otherwise. It's wanting out of life what other people seem to be able to have out of life. A certain ease with themselves.
Don't they look like old goats?
To feel the joy of relationships.
Very good.
To feel the joy of living. If I need to take Prozac for the rest of my life, so be it.